Science is simply the word we use to describe a method of organizing our curiosity. It is a capital mistake to theorize before you have all the evidences. It biases the judgment, right? A warm and pleasant day to one and all present here. My topic is intraoral photographs in forensic odontology. Before I move particularly onto the topic, I would like to give a brief introduction on forensic science as well as forensic odontology. Forensic science deals with the application of broad spectrum of sciences to answer the questions of interest to the legal system. Forensic science is also known as criminalistics. Forensic odontology. Forensic odontology is derived from a Latin word forum, which means court of law, and odontology is the study of teeth. Forensic odontology is a branch of dentistry that deals with proper handling, examination, and evaluation of dental evidences, which is then presented in the interest of justice. Forensic odontology has three major areas of utilization. Number one, diagnostic and therapeutic examination and evaluation of injuries to jaws, teeth, and other oral soft tissues. Number two, identification, examination, and evaluation of injuries, especially in casualties like mass disasters and criminal investigations. Number three, identification of bite marks, which occur with some frequency in sexual assaults, child abuse cases, and in personal defense situations. The odontological identification is based on pre-mortem and post-mortem dental characteristics of the victim or based on any other dental records of the victim. The new millennium has brought many good things to our lives, along with new challenges of terrorism, man-made disasters, natural disasters, and higher rate of crimes. Forensic dentistry aids in the identification of victims in cases of absence of fingerprints, personal defects, and in other cases of disastrous incidents like aircraft mishap, where fragmentation and thermal injuries are more common and where bodies are grossly decomposed. On the other hand, orthodontics is a dentistry specialty that addresses the diagnosis, prevention, and correction of malpositioned teeth and jaw and malocclusion. It may also address the modification of facial growth known as dentofacial orthopedics. Orthodontics, like any other specialty, has much to offer in medico-legal investigations. Dental records. Dental records, also referred to as patient's chart, is an official dental document which records all of the treatment done. Orthodontic records are of high forensic values. So meticulous maintenance of diagnostic and treatment orthodontic treatment records will be helpful in forensic identifications. There are dentists who still use paper patient records stored in file cabinets or shelves. Increasingly, they are incorporating new technologies into their practice to manage large number of existing records. Moving on to ways of identification. Bite mark analysis. It is based on the principle that no two mouths are alike. Bite marks left on chocolates, other food materials, cigarettes are also encountered. Bite marks, if analyzed properly, can prove the involvement of a particular person in crime. Next, palatal rugae. The different and unique patterns of palatal rugae may be helpful in identification only if ante-mortem records exist. It also aids in sex identification. Radiographs. The post-treatment radiographs are important tool in identification as orthodontic treatment warrants the extraction of tooth. Facial reconstruction. Facial reconstruction, also known as forensic facial approximation, FFA, is a technique based on both scientific standards as well as artistic skills to rebuild a face onto a skull to recreate ante-mortem appearance of victim's face. Moving on to one of the best and easiest methods of identification, that is using intraoral photographs. The facial or intraoral photographs taken following orthodontic treatment are very useful in forensic identifications. Clinical photographs allow orthodontists to study the case carefully. These photographic informations help them in formulating the best plan for patient's treatment and in monitoring them in following subsequent follow-ups. Intraoral cameras are preferred over normal cameras or DSLR cameras. Intraoral cameras are small, lightweight, stylish, and capture high quality color pictures. There are main classes of intraoral photographs. Number 1, maxillary occlusal view. Number 2, mandibular occlusal view. Number 3, intraoral left. Number 4, intraoral front. And finally, intraoral right. The increased use of extraoral as well as intraoral photographs for treatment plan and execution, along with popularization of digital cameras, is providing more data for human identification in forensic field. As I conclude, forensic odontology is an upcoming branch of dentistry with good scope for development. The tragic incidents of past and present have given an insight to increased importance of forensic dentistry. At the same time, the word forensic orthodontology or the name forensic orthodontology is gaining more importance due to increased use of orthodontic records for forensic identifications. Thus, the importance of forensic dentistry allow the dental clinicians yet another reason to maintain proper records, proper diagnostic and treatment records. That's all about my topic. Thank you and have a great day.